There are basically two types of genetic testing in prostate cancer. One is what's called germline testing. That's where they may take a saliva test and determine whether a patient has hereditary genes, such as BRCA2, for example, that may be linked not only with prostate cancer, but with breast cancer. So if a patient has other members in the family, such as breast cancer, colon cancer, pancreatic, or melanoma, that might be a sign that a patient is a high risk for prostate cancer. And in some cases, if there is a BRCA2 gene mutation linked with that, it may mean that the cancer may be a bit more aggressive. The good news is that if a patient has BRCA2 positivity, there are new treatments specifically for that type of genetic mutation. So that's a germline. So germline testing can help inform the patient's family about the risk for other family members having prostate cancer or maybe even breast cancer, as well as maybe selecting treatment based on the genetic mutations found in those genes. And there's another type of test called somatic testing. And somatic testing is a blood test. And what this does is detects genetic mutations that specifically happen in a tumor that may not necessarily be hereditary. And some of these mutations may be important because they may allow us to offer new forms of treatment. So for example, if there is an MSI genetic change, it may indicate that a patient may be a candidate for immunotherapy, such as Keytruda, that has been used in other cancers, such as lung cancer. And finally, there's a new genetic test that we are using in practice called ARV7, and patients who have advanced prostate cancer. If there's an ARV7 positive test, it may indicate that that patient may be in need of chemotherapy. So we've really come a long ways in the last couple of years in such a way that we can offer personalized medicine, kind of similar to when a patient may have a bladder infection and you do a test to see what antibiotic is the best antibiotic based on looking at testing. Same thing with cancer. Now we're able to offer personalized medicine, and that genetic testing may allow us to pick the best treatment for that particular patient.